The best of Money Matters. The Big Story.
Welcome to The Big Story. I'm Hongbin, Jeong. Singapore has seen a rise in COVID-19 cases recently. According to the Ministry of Health and Communicable Diseases Agency, an estimated 14,200 cases were reported in the week of April 27th to May 3rd, an increase from 11,100 the week before. Now, this surge comes more than 2 years after Singapore lifted all pandemic restrictions in February 2023, marking its transition to managing COVID-19 as an endemic disease. So why are we seeing a resurgence, and how should individuals and communities adapt to protect themselves as the virus continues to evolve? Well, joining us today to share more is Professor Paul Tambyah, who is the Deputy Chair of Infectious Diseases Translational Research Program at the Yong School of Medicine from National University of Singapore. Hi, Dr. Tambyah. Welcome to the show.
Hi, glad to be here.
Thank you so much for joining us. Dr. Tambyah, what's behind the current resurgence in COVID-19 cases?
Well, every year in Singapore, we get a spike in respiratory cases in May and in November. And we think that is due to school kids traveling or parents traveling with their kids. Because, when you travel, you tend to do a lot of things, don't get enough rest, try and see 20 places in one day. And also you're on a crowded airline or a bus or a train, and you mix with people from all over the world. So you get exposed to fresh strains of viruses that your body hasn't seen for the last few months. And that's kind of like the perfect storm. And like I said, it's been happening for years. May and November have been the peaks for influenza and other respiratory viruses.
Right.
So not too surprised.
Okay. Well, the number of people hospitalized also increased from 102 to 133 in the week of April 27 to May 3rd. So, Dr. Tambyah, with hospitalization numbers increasing, should we be concerned?
Well, I don't think so, because in the same Ministry of Health report, they pointed out that the ICU numbers actually went down. I mean, granted, the numbers were small, from 3 to 2, but anecdotally, that's what we're seeing. There are a lot of older people who are being admitted with COVID, and very often they're being admitted as a precaution because we want to make sure that they don't get into complications. Right. But the vast majority of them do fine. They just hang around for a while in the ward. We monitor them, and some of them need treatment. Some of them don't even need treatment. They just need monitoring, and they've tended to do pretty well.
All right. Then on that note, are we seeing any changes in the severity of symptoms compared to earlier waves? Or is COVID-19 becoming, milder?
Well, I think it is. And in fact, that's kind of the pattern of every single respiratory viral infection throughout history. In 1918 to 1920, there was this massive influenza pandemic that wiped out 1 in 50 people worldwide. But the same strain of influenza, the H1N1 of 1918, just became the regular seasonal flu from 1920 to 1957. So that's kind of what viruses tend to do. And that's why human beings have survived so long, is because our bodies adapt to it. And now we've got the benefit of vaccines. So a combination of vaccination and our own immune system will kind of damp down the impact of the virus. So these viruses are hard to get rid of. But on the other hand, we know how to deal with both in our own bodies as well as medically.
Are other countries seeing a resurgence in COVID numbers as well, or is Singapore an exception?
No, actually, interestingly enough, we're seeing a resurgence in Korea, Japan, Taiwan, which happen to be popular tourist destinations. So, with the long weekends that we've had in the last few weeks, it's quite possible that we've had people bringing back strains of the virus. We haven't seen the actual genetic sequencing of the viruses from the last 2 weeks, but they will be out very soon. And I wouldn't be surprised if we're seeing similar strains to what has been going around in Japan, Taiwan, and Korea.
Well, then, do you believe public health messaging has been too relaxed, especially in terms of encouraging people to continue to get, their booster shots, even after the third one, contributing kind of to the complacency among the population?
Well, I still see ads for COVID vaccine on TV and in the newspapers. So I think the messaging is still there. But at the same time, you want to calibrate it, because if you're talking about a mild disease, you don't want to, scare people unnecessarily, but you want to make sure that the messaging is targeted. So ideally, those who are vulnerable, the elderly, those with underlying medical conditions, and this is where, like Healthy ISG kicks in. Because if you have a regular doctor, then your doctor knows you. And your doctor knows that, you're someone who may not be able to handle a respiratory infection that well. So you should get vaccinated. And you shouldn't get vaccinated the day before you travel. You should probably get vaccinated a couple of weeks before you go on your holidays.
Okay. Well, will these sudden upticks in COVID cases be a common recurrence moving forward? How can we stop this pattern?
Well, I think unfortunately they are going to be a recurrence because that's what we've seen with influenza, and they are kind of predictable in May and November. Like I said, with the travel, one of the things we could do, which is what we've been trying to get people to do, is to get the flu vaccine before you travel. And if there is COVID activity in the countries you're going to, maybe you could add a COVID vaccine to that as well. So I think it's doing your homework before you go on your trip, because most people kind of plan out their holidays in advance. So one of the things you need to do is maybe seek advice from your GP or family physician about where you're going and what's the best vaccination strategy for that.
All right. Well, drawing some comparisons here between SARS and COVID-19, how did one disappear and the other become endemic?
Well, there's actually two very important reasons for that. The first is SARS was actually most infectious about in the second week of the illness. So by the time you were really infectious, you're already in hospital. So very tight isolation worked and contact tracing was highly effective. On the other hand, COVID-19 is like flu. It's infectious from the day before the onset of symptoms. So, none of us is a fortune teller, so we're not going to be able to predict who is going to be super infectious. And we can't, lock down the whole world like we did with COVID-19, because that was just simply not sustainable when, we got ways of treating the infection. The second thing is that we know what was the intermediate animal with SARS. So both SARS and COVID-19 are thought to have come out of bats. But SARS went through the civet cat. So there were areas in Guangdong where they had civet cats in very close proximity to bats. So in 2003, there was this huge epidemic of SARS, which eventually reached Singapore and Canada and places like that. But in 2004, there was actually a small cluster of 4 cases of SARS in Guangdong. But the health authorities swooped in. They found a restaurant where they had civet cats illegally being housed, and they got rid of them. And so they were able to nip the outbreak in the bud, and we didn't have SARS again in 2004 like we did in 2003. Unfortunately, with COVID-19, we still don't know the intermediate animal. So what's happened is, there's all kinds of studies in animals, but none of them are definitive, and we can't be sure. And also COVID-19 has gone on to infect so many different animals. It infects cats, dogs, deer, horses, whales. So it's just not going to be possible to eradicate it.
Right. Thank you for that great explanation there, Dr. Tambyah. Now, Dr. Tambyah, some experts have suggested that COVID-19 could evolve from a respiratory infection to a fecal-oral virus, similar to, cholera or hepatitis A. What does this really mean, and could this be a possibility?
Well, I'm one of those people who thinks that right from the beginning, there was a certain amount of, contact transmission of COVID-19. And I don't know if you remember this, but right early on when all the COVID cases in Singapore were directly from travelers in Wuhan, there was a couple that got infected in a church. And the only contact they had was they sat down in a seat which had been occupied by a COVID patient half an hour before that. So it is quite possible that there is some transmission. And, fecal-oral sounds terrible, but basically the reality is that, all of us, after using the bathroom or we wash our hands, but it's not perfect. In fact, one of the infectious disease doctors says there's this fecal patina that covers everything that we touch after we've been to the bathroom, which sounds terrible. But the reality is, the way of thinking about this is like hand, foot, and mouth disease.
Right.
So hand, foot, and mouth disease is the classic fecal-oral disease because kids, they put their toys in their mouth and they pass them around or they share drinks. And so there is I believe, and I think there's fairly decent evidence to suggest that while the majority of COVID-19 was spread through coughs and sneezing in front of somebody else, but there was a significant portion that was also spread by the same way that the hand, foot, and mouth disease is spread.
Dr. Tambyah, with COVID-19 now considered endemic, how can individuals also reduce their risk of infection? Are booster shots still effective against the current variants circulating?
Well, the WHO just issued a statement about a week ago where they said that the recommendation for the vaccine for this coming winter season in the Northern Hemisphere would remain the same with this JN1. But they did issue a caution that there are some new variants coming up And there's this other variant, the LP8, which they think the current vaccine may not be that effective.
Okay.
But there is a paucity of data. So, whatever it is, this is the only vaccine that we have right now because that's what all the manufacturers are making. So I think if you are vulnerable, if you have multiple medical conditions and you're at risk, then you should go and get yourself vaccinated. For the rest, maybe you could wait because there is a chance that the WHO may issue a recommendation for the Southern Hemisphere.
Right. Well, in the meantime, then, are there any other ways that we could reduce the risk?
Well, of course, good personal hygiene is very important. And, make sure that you stay at home when you're sick. Now, I know a lot of people in Singapore, they've gone back to the way of going to work when you're ill and then you infect everybody else at work, which is not a good idea.
All right. Well, do you also expect cases to continue rising in the coming weeks?
I don't think so. And in fact, I just had a look at the Ministry of Health weekly report, and the cases seem to have plateaued because, the figures you quoted were for end of April to the first week of May. Now, in the second week of May, the figures have plateaued and they don't seem to be going up. So it may be too early to say, but hopefully, we've hit the peak with the first week of May and the May Day holiday and all that.
All right. Well, thank you so much, Dr. Tambyah, for your time and your insights today.
Thank you.
Thank you. That was Professor Paul Tambyah, who is the Deputy Chair of Infectious Disease Translational Research Program at the Yong Lin School of Medicine from the National University of Singapore. This has been The Big Story with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.